Greetings, I'm Neil Doyle, and the title of my presentation is The Benefits and Pitfalls of Seeking Federal Funding at the Local County Level. This is to satisfy graduation requirements at the Minnesota School of Business Online Division and ultimately the RS 651 Business Plan and Project course. Quickly looking at the executive summary, the main premise of my project focused specifically on conducting government employee to population ratio studies across 10 counties in Minnesota. I selected the highest general population and veteran population counties across Minnesota. The first study specifically looked at caseload and volume for veteran service offices, and the second study focused specifically on caseload and volumes for general assistance and food assistance application offices. The results of these studies, there was significant evidence that the GEP ratio was much higher with community and human services departments than it was with the county veteran service offices. Based on the findings and results, I made 3 recommendations: a federal state funding option, a supplement option, and then just an internal funding option, which we'll explore all of these bullets in the upcoming slides. Quick introduction. Basically, after the Civil War, domiciliary care was provided to wounded veterans. Hanger prosthetics was also being developed by the first Civil War amputee when a cannonball ripped through his lower leg. And they began providing domiciliary care and veterans health care for our wounded Civil War veterans after that. Lincoln kind of started the Veterans Benefits Administration. He provided Civil War pensions to a lot of farmers that volunteered for the Civil War, became wounded or injured during their service in the Civil War, and they were unable to return to their land to farm after the war was completed. Since that time, we've embarked on several wars: the Spanish Indian Wars, World War II, Korea, Vietnam, which created millions of veterans in America. And that's really where the birth of veterans advocacy started. As the VA grew, veterans had more difficulty navigating in the complexities of the VA system. Current trends: according to the U.S. Census Bureau, there are over 21 million living veterans in the U.S. Of those veterans, almost 10 million of them are over the age of 65, and the majority of them are now Vietnam-era veterans that we serve day in and day out through our offices. As Vietnam veterans are retiring and turning 65, they're looking for a means to supplement their health care portfolios, and if they're eligible for VA benefit entitlement, they can enroll in VA health care in lieu of Medicare Part D. So that's a big influx that advocates are seeing now. In addition, there's a lot of Vietnam vets that are being diagnosed with presumptive disabilities as a result of Agent Orange exposure, which was a herbicide used in Vietnam. America is now embarked in over a decade of current conflict in Afghanistan, Iraq, Africa. We still have troops in Yugoslavia. And all of these have resulted in an increased enrollment with the Veterans Health Administration, and it's also contributed to the VA backlog in their claims process. This, of course, has put not only pressure on the Veterans Health Administration, the Veterans Benefits Administration, but it's really hit advocacy offices hard. Quickly explaining the government employee to population ratio. Basically what this is it's the number of government employees that serve the population that seeks their services. And according to the 2013 report that is published by the National Center of Veterans Analysis and Statistics, Minnesota has a veterans population of 360,000. Approximately 75% of them are over the age of 55, so our veterans population is most undoubtedly aging. Counties used for this project included, of course, Anoka, Dakota, Hennepin, Olmsted, Ramsey, Scott, Stern, St. Louis, Washington, and Wright. I am listing the counties I used, but as we get into the graphs, I did block out the name of the counties because some of them wished that their data was kept private. Quickly talking about austerity practices in government. Basically, when a recession hits and the federal government has to tighten the budget, that isn't just felt at the federal level. It trickles down to the state. When the state's budget gets cut, then it affects local budgets as well. And this has to be taken into context as I chose my final recommendations. Quickly looking at my methodology and research techniques, my project was largely quantitative comparative analysis with an advocacy and emancipatory approach and methodological triangulation approach. Numerical data was extracted from several sources. The main sources I used was the Veterans Affairs National Center for Veterans Analysis and Statistics, the Minnesota Department of Veterans Affairs Data and Statistics tool. That's where I got a lot of my age-specific data that I used in my reports. The Minnesota Department of Health and Human Services, this is where counties publish an annual report based on the caseloads of general assistance, SNAP, AMFIP, all the food assistance type benefits. And then, of course, internal data that I was able to extract from Veterans Information Management Systems. And this is largely where county veteran service officers were able to provide their client visits throughout the year. Quickly looking at the results of my survey, this is how I actually tracked and graphed the data once I extracted it from various sources. Again, I blocked out the counties just to secure their private information. If anybody would like to contact each of the counties individually, I'm sure they'd be happy to share the information. But out of respect for these counties, I did block it out. As you can see, I annotated veterans population for each county, overall population, and then I tracked the number of client visits for CVSOs. I chose client visits because typically a client visit equals an action. Or an application for benefit entitlement. And I found that if you pulled or tried to extract pending actions, a lot of the data got corrupted. So that's why I went with client visits. I selected number of cases to compare and contrast with CVSOs when I'm looking at general assistance offices, because that's how they actually report their data to the Department of Human Services. And then what I did is I inquired how many full-time staff that work the applications, both in county service officers and general assistance and food assistance offices. And then I was able to complete the formula because I had both sides of data to do the government employee to population ratio. And then you can clearly see it's much higher for family support and assistance offices. However, one note I need to make on this is family support and assistance offices are structured much differently, even internally amongst different counties. Sometimes offices strictly do general assistance applications, while others, they cross-load their work between general assistance and food applications. So in all fairness, I do have to state that there is some more complexities that should be reviewed before this is considered final data. Based on the results, I was able to come up with 3 final recommendations. The first is a federal state funding option, where basically more inclusive data would be collected amongst the entire state if you were to do a pilot, not just the top 10 counties, but the entire state. You would investigate the interoperations of the Human Services departments a little bit more so that the comparison was a little more fair, and then you would start ramping up legislative support efforts. And to do this, you really need buy-in of several organizations that I've listed up on the screen here. The second option was just a supplement option, meaning you wouldn't the federal or state would not have to supplement current operations in place, but they could supplement additional funding, basically to align the GEP ratio in more fairness in comparison to human services departments. And the last option was an internal funding option, where VSOs basically would educate their county boards internally. They could provide detailed spreadsheets and reports, executive summaries, and just let them know that the constraints of their internal office that they're being placed under is taking a toll, and eventually veteran service officers hit a point where they're not being true advocates if they get too overwhelmed with walk-ins, pending actions, and benefits that they're seeking. That sums up my report. I'm happy to field any questions anybody has after they review this. I'm citing several references that I will pull data out of for my report. And this concludes my presentation. Thank you for your time and attention.